Hello. Our musculoskeletal system is made of various, parts, including bones, muscles, ligaments, tendons, cartilages, etc. And one of the major complaints of our, joints is the, various kind of pains, especially around our knees. In the past, we used to, have patients who were usually elderly or overaged, but now this problem is very common even in young people as well. So in today's video, we'll talk about some of the causative factors. We will make, subgroups of those causes, and also we'll see that what are some of the best, complementary or holistic remedies which can help reverse this condition and also help with alleviation or, improving your symptoms as well. So this video is about chronic and recurrent severe kind of knee pains. If you have knee pain one-off, that's not a major concern, but if somebody experiences knee pains quite often, that should be considered seriously, and you need proper treatment for that as well. Conventionally, when you have knee pain, you take various kind of painkillers which are also known as analgesics, including paracetamol, ibuprofen, cocodamol, diclofenac sodium, diclofenac potassium, etc. And if it doesn't help, then the next step is to have some sort of steroid injections, which can also help alleviate pains for maximum 3 to 6 months. But again, you get these problems and you have to approach your doctor for further treatments as well. Sometimes they offer you various kind of surgeries, including knee replacement surgeries as well. But it's best to find the causative factor behind that. And sometimes the causative factors, if they are improved, if you address those risk factors, you can improve your condition quite a lot as well. And that is something I'm going to discuss in today's video. So one of the major causes for your knee pain is the aging. As we age, as we get older, especially when we reach around 40-50, our degeneration starts, and that not only damages our other organs, it also affects our joints, including our knees as well. Because the thing is, with age, you have wear and tear in the body, and that can cause inflammation and pain around your knees as well. Another concern for knee pain could be an autoimmune condition. As you may know that there are over 85 various kind of autoimmune diseases so far people or doctors have discussed on, and rheumatoid arthritis is one of those, and that can also affect your various joints, including your knees. Also, gout or high uric acid deposition can also cause knee pain, sprains and strains, or even after overusing or overstretching or twisting of your knees can also cause pains as well. There is a condition in which your ligaments or cartilages, which are special kind of fibrous tissues which connect your muscles with your joints, they are torn, they tear apart, and they can cause pains as well. One of the causes for knee pain is also in the kneecap dislocation. So if for some reason, because of an injury or a physical trauma, if your kneecap is relocated or dislocated from its original place, it can also cause pains as well. And one major cause for knee pain again is lack of certain nutrients in the body, especially people who live in cold climate where there is lack of sunlight. So there's a big problem of vitamin D, and that can cause deficiency. Also people who are deficient in calcium, in magnesium, in phosphorus. So there are many important minerals which help build your joints, your muscles, your bones together as well. So if you're deficient of some of those vitamins or minerals, you may have this problem as well. And finally, another big factor, which is one of the leading causes of many health disorders, including your knee pain, is being overweight or obesity. As you know that if you are obese or overweight, it can put pressure on your lower limbs, on your lower extremities, including your soles, at the heel of your pain, around your ankles, and also on your knees as well. And that can be too much trouble for your knees to have that burden. Up to some extent it's fine, but if it's too much weight on them, it can cause a lot of pain down there as well. So these are some of the basic causes and risk factors for knee pain. But now we are going to subgroup these symptoms into 3 big categories, so that we can also have 3 separate group of medicines which can also help target those causes and symptoms as well. So the first cause for knee pain we will consider as an osteoarthritis. So osteoarthritis is a type of knee pain which is due to older age, due to friction, due to overuse of your knee joint. It is also due to wear and tear of that as well, which can cause inflammation, redness, swelling, stiffness, and also cracking sound in your knee pain as well. So that is one of the groups of that kind of knee pains as well. The second subgroup we can make that could be because of rheumatoid arthritis. So if you have rheumatoid arthritis, definitely definitely it is due to an autoimmune condition, and the medicines groups would also be different for a patient who suffers from rheumatoid arthritis from those who suffer from osteoarthritis. So if you have rheumatoid arthritis, normally you have a lot of pain, stiffness, swelling, and when you touch that part, it feels warm. There's a heat or heating sensation around that. But if you touch somebody with osteoarthritis, their joint may look cold. But in rheumatoid arthritis, there's a differentiation kind of symptom between both. There is a coldness, and here you will feel warmth as well. Also the joint may look red, and also there's locking that making it hard to move smoothly, and also there will be some kind of effusion, which is the serous membrane inflammation. There's a membrane between two joints which is called serous membrane, and it becomes inflamed in rheumatoid arthritis. So there are specific medicines which can help remove that inflammation from the serous membrane. So you don't have to use the same medicine or same group of painkillers or analgesics for all kind of knee pains. We have to differentiate them and take medication accordingly. That is something I'm going to suggest now. Another group of medicine which could also be very much helpful for uric acid depositions. So if you've got gout, normally people think that gout is only in your toes, including your big toe. Start from big toe, but let me tell you that gouty arthritis could be anywhere in the body, because the thing is, wherever your body or your blood takes uric acid, it can cause stiffness and pain there. So if you have high levels of uric acid in your knuckles or in your fingers, you may have problem over here. It could also be around your shoulders. So normally with gouty arthritis, we have a feature, and that is shifting pains. I mean, the kind of pains which don't remain in one place, but they keep shifting from one place to another place as well. So now this group of medicine which I'm going to discuss will be for arthritis of gouty nature, in which there are also damage of your ligaments and tendons as well. You may have swelling, and also itching and peeling of skin, and also redness around the joints as well. So these are three major groups of various type of conditions which can affect an individual with the severe knee pain. And if you take your medication according to these causes, most likely you can reverse the conditions quite effectively. But before I jump into the groups of medicines, especially for these groups, I'm going to share you some external use aromatherapy essential oil, because if you have a lot of pain and if you depend on painkillers, it's always best to go for something which is safer, which you can apply externally on the affected parts, and you get quick relief as well. So first of the natural remedy or complementary remedy I'm going to share with you is a blend of aromatherapy essential oil, which is very effective for various kind of rheumatoid arthritis, osteoarthritis, and also for gouty arthritis as well. So you can make this oil at home as well. So I'm going to tell you that what three basic essential oils have been mixed together in this blend. So the first essential oil which I put in this blend is called geranium essential oil. The next one is called eucalyptus essential oil, and the third one, which is very effective for pain and any kind of swelling in the body, is called marjoram essential oil. So what you can simply do, you take about 100 milliliter of any carrier or base oil. It may be mustard oil, sweet almond oil, or any oil of your choice, and put 10 drops of each of geranium, eucalyptus, and marjoram in that, and your blend is ready to use. So simply mix it, you can label it and apply externally. But I'll give you a tip here, because many people the way they massage their body can also damage further in their bodies as well. So try to learn the basic tips of massage. And for knee massage, please remember that never massage over the kneecap. If you massage over the kneecap in this position, it can further damage. So it's always good to massage all around in circular moves, either clockwise or anti-clockwise. So simply try to penetrate oil in between the joints, right? And that will give you a lot of improvement in terms of its mobility, its stiffness, and also pain and swelling relief as well. So instead of taking painkillers, I will suggest that yes, you can take them if you are in too much pain and if you can't tolerate the pain for quick relief. But otherwise, if you use aromatherapy essential oil blends, they are also equally effective for those kind of conditions. Now the second group of remedies are herbal supplements. So if you want to take something internally as in replacement of painkillers, I'm going to suggest you top 3 herbal supplements. And please remember that this video is not intending or intent to cure, diagnose, or treat any medical condition. So try to avoid, always avoid self-medication. If you have to use any herbal medicine or any complementary remedy, make sure to speak to doctor, health provider, or at least speak to a qualified herbalist or aromatherapist so you can get proper advice. Because even herbal supplements can be sometimes, dangerous, and they can can leave unwanted side effects in the bodies as well. But anyway, the top 3 herbal supplements for various kind of joints and muscular pains, including knee pain, is the first one is called ashwagandha. And it's a great plant which can help relieve joints swelling and stiffness. So if you've got too much stiffness and joints swelling, ashwagandha supplement can be really helpful. Another supplement which you may consider is called omega-3 fish oil or cod liver oil, and it has a specific property of anti-inflammation. It can reduce inflammation from anywhere in the body, and if you have less swelling or inflammation in the body, you have a lot of improvement as a general quality of life, but especially around your painful body parts as well. And one more daily supplement which is a kind of enzyme, and that is called bromelain enzyme, and it is mostly found in pineapple. So you can either take pineapple if you don't have diabetes, otherwise you can buy its supplement and just take 1 or twice as per recommended daily allowance from the label on daily basis. So if you consider either ashwagandha, omega-3 or even bromelain, so they can complement your mainstream medications. You can also consider chondroitin, you can also consider glucosamine. There are so many complementary remedies which can help aid your mainstream medications as well, because sometimes these all work together. They give each other synergistic effects as well. So try not to be dependent on simply analgesics or painkillers which you are getting over the counter or normally suggested by your doctor. Yes, you can take if you are really in desperate need, but otherwise you can consider these natural remedies which can also be sometimes really helpful. Now toward the end of this video, I'm going to suggest top 3 groups of homeopathic remedies which can be used for various kind of arthritis or various kind of knee pains. So the first group of medicine is for osteoarthritis, which is about your older age or because of wear and tear. So if you suffer from knee pain due to osteoarthritis, you should consider these 2 remedies, top 2 remedies. So the first one is called argentum metallicum, and take this remedy either 30 or in 200 C potency. And apart from that, you need to add another medicine which is from another group of medicine called biochemic, and that is Silicia 6X. So take these 2 remedies at least 4 pills up to 3 times a day for 2 or 3 months. Also make sure to ask your local pharmacist to give you these remedies not in drops but as in pills, and take 4 pills at a time up to 3 to 4 times a day directly on your tongue, and they will melt and you can simply absorb these medicine and they will give you medicinal benefits as well. So if you suffer from osteoarthritis, you need to consider argentum metallicum and Silicia 6X. But if you suffer from rheumatoid arthritis, another group of problem which is due to autoimmune disorders, now the medicines will change because there is much more serous membrane inflammation there. There is synovial fluid inflammation there as well. So there's a different kind of damage. This inflammation, swelling, redness, heat. So if you have those kind of conditions or sensations, the medicines will be Apis mellifica 30 or 200, and the other medicine that will complement Apis mellifica is called Brainia alba, again in 30 or 200 potency. So again, if you have rheumatoid arthritis, consider these 2 remedies, again 4 pills up to 2 or 3 times a day, 2 or 3 months, and you will see a lot of improvement. Some people, unfortunately, and sometimes it gives us a lot of issues as well, because they suffer from chronic conditions like arthritis for the last 15-20 years, and they expect magical results within 1 or 2 weeks, which is not possible. So if you are looking for quick fixes, yes, you should continue with your routine conventional medicines, but if you want to reverse your condition and if you're looking for long-term wellness, you should consider homeopathic remedies. But don't expect too quick results, like if you want that you take these remedies for a couple of weeks and you will be completely cured. That is not possible. Then I think it's better to avoid them. But if you have some patience, if you want to see some result, you must continue with these remedies for 3 to 4 months so you can see some expected results. Now, my dear viewers, I will talk about the third group, which is about the damage in your ligaments or tendons. And if you have that is problem around your knees, that you think that your ligaments are very weak, they are very much not in their right or very strong position, then you can consider the 2 remedies. And the first one is called Rustrox 30 or 200, and along with that you have to add another medicine which is called Ruta 30 or 200. So consider these when you think that your ligaments, your tendons are badly damaged, and your diagnostic reports from your doctor or your GP will also confirm that. So you should consider these groups of medicines as per the causative factors, and if you consider these medicines according to the specific cause or reason, you will have much better results. So thank you very much for watching. I hope that you would have learned something new in this video. If you like my effort, if you like the way I discuss about various conditions and I offer various complementary and alternative remedies, please like, subscribe to my channel so you can get future videos as well. And also, if you know somebody who suffers from knee pain and they need some help, please share this among your contacts as well. But again, as I've said, avoid self-medication, speak to doctor or health provider. And if you need some more specific help or advice, you can always contact my clinic, which is in Birmingham, and my details are here. You can always send me a text message or arrange a video consultation. So thank you very much for watching, and I will see you again with another very important topic. Until then, take care and bye bye.